Hello, everybody. Today I will be speaking on the topic of what causes today's youth to become self destructive. And when researching this topic, I came across a lot of sources that only focus on the cure or how to stop self destructive behavior, and very few channels actually focused on the cause of self destructive behavior. How are people to cure themselves when they don't know the cause of their suffering? It is easier to follow a plan someone else made than to talk to yourself and find out the reason why are you self-destructive. What is self-destructive behavior? Self-destructive behavior is when you do something that is sure to cause self-harm to you, physically or mentally. It may be unintentional, or it may be that you know exactly what you're doing, but the urge is too strong to control. It may be due to early life experiences or mental health conditions such as depression, anxiety, personality disorders, or post-traumatic stress disorder. Some self-destructive behavior is more obvious, such as attempting suicide, which may be caused by depression, overwhelming sadness, or loss of interest in daily activities. Binge eating, compulsive activities like gambling, gaming, shopping, or impulsive and risky sexual behavior, or dependency on alcohol or drugs, or self-injury like cutting, hair pulling, or burning. Now, there are also more subtle forms of self-sabotage. You may not realize you're doing it, at least on a conscious level. Examples of this are being self-derogatory, changing yourself to please others, clinging to someone who is not interested in you, engaging in alienating or aggressive behavior that pushes people away, or wallowing in self-pity. The frequency and severity of these behaviors vary from person to person. For some, they are infrequent and mild. For others, they are frequent and dangerous, but they always cause problems. What are common risk factors for self-destructive behavior? You may be more prone to behave in a self-destructive manner if you have experienced alcohol or drug use, childhood trauma, emotional or physical abuse, friends who self-injure, low self-esteem, unemployment, verbal abuse, or having a victim mentality. If you have one self-destructive behavior, it may raise the likelihood of developing another. Sources show that self-harm is common in both people who have and do not have mental health diagnosis. It can happen to anyone at any age, although teens and young adults are more likely to engage in physical self-injury. What's the outlook for people with self-destructive behavior? Risky self-destructive behavior can increase the risk of poor mental health outcomes and premature death. But you can fully recover from self-destructive behavior. How long it takes depends on frequency and severity of symptoms, whether you have other conditions such as depression and PTSD, and your specific self-destructive behavior, or whether it's linked to such things like alcohol abuse or eating disorder. Your outlook depends on your individual circumstances. We do know that therapy and medication can be effective in treating variety of mental health disorders. Your doctor will be able to give you an overview of what you can expect. Ways to overcome self-destructive thoughts. First, find out your needs. Second, live authentically. Third, forgive freely. To develop positive self-view, you must keep in mind that everyone makes mistakes. Fourth, celebrate your quirks. Each of us is one of a kind. When we cherish our eccentricities and celebrate our flaws, we begin to develop a deep love for ourselves just as we are. The bottom line being, self-destructive behavior is when you repeatedly do things that will harm you physically, mentally, or both. It can range from mild to life-threatening. If your child's negative view of the world interferes with their daily life, that is school, friendship, and other activities, seek professional help. A victim mentality can also be a sign of a mental health problem like depression or anxiety. If you think you are engaging in self-destructive behavior, you probably are. You don't have to live in this way. You deserve better. See your doctor or find a qualified mental health professional. In therapy, you can work through the cause and effect of self-destructive behavior. You can find new coping skills and practice alternate behavior. You can live a happier, less self-destructive life. Thank you.